Good evening, and welcome to Thinking Thursday. I'm Bronwyn Lucas, your host, and we have a guest this week, Dr. Kelly S. Dempsey, and we're going to find out a little more about her in just a little bit. If you've ever watched Thinking Thursday before, you know that we always start out with deep breathing. And Dr. Dempsey, we want you to join us in our deep breathing tonight. And later on, I'll ask her a little about this as well. But deep breathing has very many positive benefits, and we do it every week just to remind you how healthy it is and how good it feels. So if you've never been with us before, I want you to do something. I want you to put your hands on your stomach. Because when I ask you to breathe in, I want you to breathe in so deeply that it not just in your chest, you're going to feel your stomach expand because you're taking in that much deep air, filling those lungs with air. And then you will exhale. I'm going to count into 4. While I'm counting into 4, you'll breathe in, and then I'll say, breathe out to the count of 4, and we're going to take 3 breaths. So let's try it. Breathe in, 2, 3, 4, out, 2, 3, 4, in, 2, 3, 4, out, 2, 3, 4, in, 2, 3, 4, out, 2, 3, 4. Hopefully that gave you just a moment of woosah and to feel a little more relaxed, because anyone's day can be filled with just a lot going on. So this is an opportunity to just refresh if not for just a moment. Well, Dr. Dempsey, I am so glad you're here. She is a breast surgeon in the Houston area, and it is Breast Cancer Awareness Month. And in honor of Breast Cancer Awareness Month, I wanted to do as always, provide education. So she's here to talk to us. And I have tons of questions that we will share, and she has tons of answers. So Dr. Dempsey, just tell us a little about yourself and where you're from, and how did you choose this profession?
So my name is Kelly Dempsey, and I'm from New Orleans, Louisiana. I got married in 1999, which was the same year that I graduated from medical school in New Orleans from the LSU University School of Medicine. And we picked Houston for my residency because I wanted to be a pediatric surgeon, and this was the best place to come. Through a series of events that happened during my training, I very quickly came to realize that this was not where God wanted me to be. I loved caring for children. I loved surgery, but doing it at the same time and sometimes dealing with parents that didn't care for their children properly, it was very hard on me mentally. And so I ended up making a choice that I was going to listen to God's plan for my life and follow his direction. And through a series of events, including an interest in plastic surgery at one point in time, I realized I was happiest when I was helping women to fight breast cancer, because it is an early curable problem in most situations. And that's what I want to do. I want to stand by you and walk you through that journey and hold your hand when you're afraid.
Awesome. I like the way you say that last part. Walk beside you and hold your hand when you're afraid, because this is a scary journey that many people have to encounter. So many have to encounter this really scary journey. So tonight, I want to help educate my audience. We can never learn enough about any topic. So I want to talk about breast cancer. But I mistakenly thought oncologist, but you're a breast surgeon. Can you tell us what that is?
So, as a breast surgeon, I like to joke that I take care of sick boobies and make them well. So any problems of the breast, be it lumps, bumps, pains, or cancer, precancerous lesions, that's my entire world. As a true oncologist, you are in one of three fields, and we work together very closely. There's surgical oncologists that operate, there are medical oncologists that give medicine, and there's radiation oncologists that give radiation. I fall under the category of surgical oncologist, but rather than being trained in every cancer, I chose to focus my career only on breast cancer.
Wow, thank you. And I think it's enlightening just to know the different types of oncologists. Let's dive into breast cancer. You know, we have a lot of thoughts about breast cancer, and some are true, some are false. Before I go on, I'll ask anyone who is listening, hit the share button if you're watching us live on Facebook, and share this information so others can be aware. If you have any questions, I will try to be able to monitor that and pass them on to our doctor. So I have a question. Is it true that cancer, breast cancer, or any kind of cancer kind of falls in a family, so that if you might feel like, well, there's nobody else in my family has it, it can't be me. Is that true or false?
That is definitely false. So in terms of family history, if you do have a family history, that is an important indicator that you might have a higher chance of getting breast cancer. But the truth is that 80% of breast cancer starts in women with no family history.
Wow. So does your lifestyle, what if you're this healthy, super healthy person who, you know, I do all the right things, eat all the right things, eat organic? Does it help in terms of breast cancer?
Yes and no. Have I had many vegetarian patients with breast cancer? Of course. So there's not one single thing that can prevent breast cancer, just like there's not anything that any one of us can do to cause breast cancer. And so that's when I talk to my new patients, I would like to focus on the stages of grieving. And one of that is that, what did I do wrong? What did I do to make this happen to me? And the answer is absolutely nothing. It is bad luck, and it happens to 1 in 8 women, and that's the person that it happened to. But are there things that can reduce your risk? So if you get in a car, you can get in an old classic from 65, or you can get in a new car that has airbags. There are different things now that we know will reduce your risk of breast cancer. And so those are the things we like to focus on, the things that we can change in our lives. So staying a healthy weight is ideal. That is your best defense against any form of cancer, but also especially breast cancer, because breast cancer in most cases is fed by estrogen. And the more excess body fat we carry, the more risk of breast cancer we have of developing. So that is one thing that we can change. We can't change when we start or when we finish our periods, but we can watch what we eat and try to eat colorful fruits and vegetables full of antioxidants. And I am a big proponent in terms of organic. There's something you can Google called the Dirty Dozen, and it is the 12 fruits and vegetables that are recommended to be eaten organic, usually because they have a very thin skin and are more likely to absorb pesticides and things like that. So you're talking about your strawberries, your celery, any kind of berries, tomatoes, all of those sorts of things with very thin skin, opposed to oranges and bananas that have a thick protective skin that we're going to peel off and not eat.
And, you know, I can say personally, I do know that healthy lifestyle doesn't help prevent it. My younger sister was a yoga instructor, she exercised regularly daily, had run a marathon, ate healthy, and she had breast cancer. But cancer in general is something that runs in our family, should I say, and not just breast cancer. There are other ones that, it's just very prevalent. Breast cancer, but others are prevalent. And she lived a healthy lifestyle.
Yep, absolutely. We do know 150 minutes of exercise each week not only reduces your risk of getting cancer, it improves your survival if you do get cancer, and it reduces heart disease too. So it kind of takes care of everything. So I do recommend, and it does not have to be, sweating to the oldies or anything like that. It can be just a nice brisk walk, not jogging or anything like that. Because believe me, if you see me running, you better turn around and run too, because something's chasing me.
Sounds good. And I'm a big proponent of just walking. I'll say this about walking. So as a therapist, I see clients, and some days I see lots of clients. So I hurt my knee recently, and I am vigorously working to get it back to where it needs to be. But I would schedule 2 15-minute walks. And if I had 9 clients, I would literally schedule 2 15-minute walks as opposed to a 30-minute walk at one time, because it broke up my day, and it allowed me to clear my head because I'm outside, and just kind of get out of the office and breathe and woosah. And when you talk about just the benefits of exercise, they're mental as well as physical exercises. And what I say, if this is your first time, I always like to explain that health is health. We like to separate mental health and physical health. When you impact one, you impact the other. If you have cancer, it's going to impact your mental health. Am I right, Doctor?
Absolutely. Absolutely. Approximately 50% of cancer patients will develop some form of situational anxiety and depression. And that is, for people who aren't aware, is where a situation in your life is more than you can handle on your own. It's just too overwhelming. And so there are so many resources that we have access to as doctors, as therapists, so many resources that we have, that I open that door at the very first conversation and say, I actually give everybody 3 $10 bills that have my face on them, and they're called Dempsey dollars. And each one allows you to be miserable for a day. Stay in bed the whole day, watch Lifetime, Oprah, and the Hallmark Channel, and eat your junk food of choice. But you only are allowed 3 days, because I want my patients to get that out of their system, grieve the fact that you're having cancer and it is changing your life forever. And then let's pull up our big girl panties and start fighting.
I like that. And I always say we have to own our situation, own your mental health, own your depression. And some people disagree with that. I said, no, you know why you need to own it and not ignore it? If I own it, it's mine, and I can I can manage it, I can change it, I can throw it away.
Yep.
But you have to own it. What about age? Is this just an old woman's disease, breast cancer?
Actually, no. In this country, the peak incidence for breast cancer in women is between 65 and 75. And so that's the tip of the bell-shaped curve. And so you're going to have people well into their 80s and 90s with breast cancer, and you're going to have women in their 30s and 40s. Now, An interesting fact about the African American community, which is something I am particularly attuned to with my patient population, and is something I'm extremely passionate about, is that there are differences between ethnic groups and racial groups and their types of cancer and when you get it. So for example, African American women are more likely to get breast cancer at a younger age, whereas white women are more likely to get it at an older age. Vietnamese women are more likely to get it before the age of 50 and peak at 55 and then go down, while white women and Western women of any color, that incidence is still increasing over time. So there is definitely ethnic group, racial groups, all kinds of differences based on where you grew up on the planet, lots of different things. And so it is extremely important that you have a doctor that is in tune with the different, not only health disparities and medical disparities within our communities, but also the implications of genetic differences between all of us.
Are there any studies that speak to why you see these differences I know, we figured them out that they exist, but I find that very interesting.
We don't know. And that's the truth. There are several factors. We talked earlier about the things that you can change and the things that you can't. So, one thing that we can't change is when we start our first period. Well, I had a young lady that was my assistant in the office. And when I found out that her daughter was having a period at 6 years old, I freaked out. I'm like, oh my gosh, no child should have a period at 6 years old. And so I set her up with all kinds of specialists. And lo and behold, I learned not only is that not rare, it is actually more common in the African American population to start your period at an extremely early age. And so I see a lot of African American women having periods 7, 8, 9 years old, long before we as mothers even thought to talk to them about their bodies and the changes that they'd be going through.
Now, is that something new, seeing the 7?
Yes and no. Throughout history, yes, as an entire generation of women in these centuries that we're living in right now, the 20th and the 21st century, yes, women are more frequently starting their period at a younger age than they did in the 1800s, 1700s, etc. But at the same time, lifestyles were very different then. And so you have differences in diet. We now have processed foods that are not eaten in other countries and that are not eaten in history. There are differences in terms of environmental exposures. We now have a lot of hormones in our foods. So when you see hormone-free milk and hormone-free meat, one of the things that we suspect, we can't prove it, but we suspect that maybe girls and even young men are starting their pubertal changes at an earlier age because of hormones in our food supply. We're using soy as a filler in a lot. I mean, I just looked at a box of, I don't know what brand of cookies, chocolate chip cookies, and there was soy in it. I mean, it's literally hidden in almost everything that we eat because it is a cheap filler to make things go further. And so as we eat more processed foods and things, we are being exposed to different chemicals. We're being exposed to different carcinogens in our environment. I have families where an entire generation of kids ran through the fields in the country because in our part of Houston, we get a lot of people coming in from, rural areas. And these kids all grew up running through the same fields that grandma and grandpa were, doing the crops and putting pesticides. So I have generations where there's nothing genetically wrong with any of this family, yet every single member of the family has had some kind of cancer.
And it's the pesticides they were running and playing through.
Yeah, I mean, especially back in the 40s, 50s, and 60s, there was very, very little regulation by the federal government. Nowadays, it's much better, but now those are the people that we're seeing coming into their 60s, 70s, and 80s and 90s. And those are the families where you're seeing lots of cancer run through the family. So that is one of the questions I asked. Hey, did you grow up in a rural family? And they'll say yes. Or I had a family that grew up in Mexico and daddy worked at a chemical plant, yet all the girls washed all the laundry. So all of the girls were washing daddy's clothes and handling the chemicals before we even knew that these chemicals could hurt them.
Mm. And so you bring up a good point, how much environment plays in getting any cancer that we are not aware of. Yep. Those environmental, like you said, the girls washing daddy's clothes. That is the role. Daddy's going to work, the girls are going to wash the clothes, not even knowing you're putting someone at risk. And think about, the idea of running outside, playing in the fields could be hazardous to your health because we think of it, you're outside, you're in nature, you're running, you're free, but you're running through pesticides. So there's so many environmental things we don't even think about. Yep. Because you would definitely think being able to run outside and play in the country, as we call it, is a much healthier lifestyle. Who would think that part of it could not be?
Yep.
Wow. And just living in the urban environment, so many environmental, just the pollution. I don't know if
Yes,
it has anything to, but we're breathing in so many toxins. And I know in Houston, there are certain areas where they have found cancer clusters, like by the ship channel. There's some
absolutely.
out here. And when you look at it, you see toxins in the air. It's like
Yep.
you can just see the pollution. And they've proven that there are cancer clusters in areas like
In Louisiana, South Louisiana, when I was in medical school, it was called Cancer Alley because all of the upstream farms and the runoff from all of the farms goes into the Mississippi River, not to mention all the various chemical plants that use the water from the Mississippi for cooling and heating and things like that. And so by the time you get to South Louisiana, you have an extremely high cancer rate amongst anybody of any ethnicity within South Louisiana.
wow. And environmental things are things that are harder for us to even think about doing something about.
Yep.
But I think in the awareness can make changes in individual. For instance, if I were a person living in a rural area and I found out about, kids running through the fields where you're putting pesticides on it, hopefully you can find something other than pesticides if these are foods you're going to eat.
Mm-hmm.
But, so being aware of these environmental dangers can be very beneficial. Sometimes you hear some other things that sound a little crazy and people put out all these articles and you're like, is it true?
Mm-hmm.
One of them is deodorants cause breast cancer. Can you?
Nope. That's a big old no. So the reasoning behind it is sound and it's logical. So I'm not going to beat people up for it because it makes sense. Your skin is the largest organ of your body, and you have collections of sweat glands in various parts of the body in order to cool the body. And so one of the thoughts is that if you are not sweating properly through your armpits or other places, then theoretically toxins that would otherwise be emitted through your sweat, just like your kidneys and your liver help take care of toxins, then somehow you're trapping those in your body. There was also thoughts about talc. And I love to tell my patients that, no offense to any of my lawyers out there, but lawyers are faster than doctors. Lawyers are faster, politicians are faster than doctors in science. And so there's lots of lawsuits that have been out in the past, especially one that I come to mind is the silicone implants. And there were studies that came out about 10 years after those lawsuits were filed and settled that showed that the same number of women had the same health problems, rheumatoid arthritis, fibromyalgia, lupus, all of the things that were supposedly linked to silicone. The same number of women had those health problems who'd never had silicone in their body. But we had to have enough time to figure out what was going on.
Wow. So what was the link with silicone? I remember that. So you're saying there silicone really wasn't tied to?
It wasn't. Yes, it leaked, and yes, it could travel in your body. I have ladies who have blobs of silicone deposited in their lymph nodes in their armpits because their lymph nodes were doing their job, cleaning up things that don't belong. And so a leaking implant in those old days was not good for you, not because it caused cancer, not because it caused you health problems, but it can cause pain and it can travel into your lymph nodes and cause inflammation and swelling in the lymph nodes that become painful. So it was not good to have leaking implants. And we were ignorant, quite honestly, when we invented those silicone implants because we didn't even occur to us that they might leak. But nowadays, we actually prefer silicone implants in our reconstructive patients because the cosmetic and sensation feelings of it is so much more natural than the saline. But nowadays, we have what we jokingly call gummy bear implants. And so if you cut a gummy bear in half, it's not going to ooze all over your table. It's called a cohesive memory gel is the technical term. And I liken it to the difference between gummy bears and a jar of Bama jelly. If you tip over a jar of jelly, eventually it's going to ooze out. But a gummy bear will never ooze.
Wow, that's a good way to explain it. So we've improved silicone implants over time,
Yes.
which is good. And what about bras? Does it matter which kind of bra you wear, or if you don't wear a bra at all? Does that have any? Some people would say, underwire bras are what you should wear, you shouldn't wear, or what if you don't wear a bra at all?
I've heard it all. And what I'm going to tell you about bras is this. Number one, underwire cannot cause breast cancer. So wear your underwire if you want to. Can underwire cause scratches and scrapes on your breast that can actually be quite traumatic to the breast? Absolutely. I had a lady who came in and the underwire broke out of her bra, caused a scrape, and she ended up with a large wound that we treated for 2 to 3 months. So I personally avoid underwire, but that's just because I don't like it. So the support is not coming from the underwire, it's coming from the volume of elastic in the bra. And so there are a lot of really good wire-free bras now. I personally buy mine at Walmart and Target, but wire-free bras that are comfortable for daily wear and will give you the support that you need. As far as burning your bras like we did in the 60s and not wearing bras at all, sure, a lot of my elderly ladies don't like to wear bras at all. The problem with that is anyone that is big busted or has breasts that are going south, droopy breasts, heavy breasts, if you don't keep them off of the upper abdominal wall in some form of lift and support, then that warm breast skin rubs against the warm abdominal skin, and you can get a very difficult, smelly sometimes problem. It can turn into rashes and wounds again underneath the breast where your skin tears because it becomes extra fragile. And that problem is called intertrigo. It is a dermatological problem. It can happen in the armpits. It can happen in the groins. It can happen between the thighs. It's anywhere that warm, moist, dark skin rubs together. And so I do recommend trying to keep the girls up a little bit if you can. And if you do have intertrigo, there's a lot of good prevention techniques that will help keep it from getting to be a very nasty and uncomfortable mess.
Wow, that's some interesting information about keeping those girls up.
Yep.
Wow. What about mammograms? We hear that, and especially it used to be in October, you could definitely find someone, doing mammograms. You had the mobile trucks since COVID. It hasn't, been as prevalent. But can mammograms always find the cancer?
No. Mammograms inherently will miss 12% of breast cancer. It misses cancers that tend to be around the edges of the breast because you're trying to put a basically circular shaped structure into a two-dimensional thing. And so as you get close to the chest wall, you can't get 100% of the breast tissue onto the mammogram field. So that's problem number one. Problem number two is that there is a certain kind of breast cancer that is particularly sneaky, and it's not necessarily more aggressive, but it is oftentimes found much later because it doesn't show up well on mammograms. It doesn't show up well on ultrasounds. It is usually not diagnosed until it's big enough to be felt. And it only shows up on MRIs, and MRIs is a third line test after you found a problem. So we're sort of going to always have this issue. Now, in addition to mammograms is ultrasounds. And so many of you may have heard of something called Henda's Law. It was some laws that were passed around the country to try and inform women that if you had dense breast tissue, you may need additional testing. And that's where the ultrasound comes in, that if you have dense breast tissue, you may need an ultrasound in order to look through the thick white patches that are on your mammogram image and see if there's anything solid hiding within those patches.
Thinking about the breast cancer and then doing the monthly breast exams, which most women don't. We know we should. First, how important is that? Because so many people do not. What can you say to encourage women to do the monthly self-check?
So the first thing I do is I say, don't worry about it being monthly or on a specific date. If that works for you, if you're the kind of person that remembers, I have to give my dog their pills on the 15th of this month, I will go ahead and give my breast exam on the 15th of the month. That's great. If you're even remotely ADD like I am, yeah, no, I can't remember when to give the dogs their pills, even when I have reminders in my phone. I just am always being pulled in so many different directions. So the one thing that I really like to do and talk to women about when I give public presentations is I like to demystify the breast exam. It doesn't need to be a complex, difficult procedure. It doesn't need to be where you're sitting there worried about, am I doing this right? Oh, I don't know how to do this right. I guess I'm not going to do it at all because I don't really know what I'm doing. So when I give breast talks, I like people to raise their hand if every single person in the room, if any of you brush your teeth or brush your hair at least from time to time. And everybody raises their hand. And then I ask them, does everybody in this room, anybody in this room, at least take a shower from time to time? And everybody raises their hand. And I said, well, guess what? If you can do those two things, you can do a breast exam. So the first things first, when you get in the shower and you're soaping up, I want you to look at whatever is in your hand. For me, it's a pink puff of some kind. And so I look at that pink puff and I say to myself, when was the last time I put this down? And if I can't remember the last time I washed my body without something between me and my skin, like a washcloth or a puff, then it's time for me to put it down and wash my body with my hands. And if you wash your body with your hands, you are going to find all kinds of interesting things about your body that you may or may not know were there. And so it's important to know who you are and what you're made of and what your parts look and feel like, because we are the stewards of our health and our stewards of our bodies. And so we have to take care of them. And to do that, you need to be familiar with yourself. So then I say, well, if you brush your hair, brush your teeth, every so often when you're looking in the mirror and brushing your hair, brushing your teeth, I want you to look down and think, I don't know the last time I did this without my shirt on or my jammies or whatever. And so if you can brush your teeth or brush your hair and look at yourself in the mirror naked, then you've just done the second half of your breast exam.
Cool. That does take away the rigidity of having to do it at the same time every month. And I think some people think, well, I don't do it regular, so I won't do it at all.
Yep.
So that does take away that. So if you, so let's say you're somebody, there's a range for people who do it first. For some people on this one, the first of the month is their day to do it. Because, and that makes sense, I get it. It's the first of the month and they're very structured. The first of the month, I do my breast exam and I change the filter in my air conditioner. Okay. It's the first of the month. All these little things had a list of funny little things that had to be done once a month, and they all happen on the first of the month. Great. Everybody cannot be that structured. So you gave us some, structure. It's better to do it than not do it at all.
Exactly.
But let's say we're doing it and you're that structured and you never find a lump. Does that mean I'm home free?
No. So we want to find breast cancer before you can feel it. And so that's where mammograms come in. Mammograms can pick up things that are the size of sand and salt crystals. We're talking teeny tiny polka dots. Take a pen and dot it on your page. And that's the size of the calcium deposits that we can see on a mammogram. And we can find breast cancer. And so since 1970s, when mammograms really became encouraged, what we've seen is that we are catching it at earlier and earlier stages across the board. And with that being said, we are catching it before you can feel it. And therefore, more people are living and not dying from breast cancer each year. As far as sometimes people say, well, I don't know what I'm feeling for. And that's the one thing I wish, if I could go into high school health classes and teach every young lady what it is that you're feeling for, I would love to do that. So the simplest example of what to feel for is to take the first knuckle on your finger, and I can't do it because I'm holding the phone, but touch that knuckle with your eyes closed. That is how hard a cancer is going to feel. If you feel anything in the realm of something that feels like a bone, a knuckle, a rock, a pea, a BB in your breast, then it needs to be checked out by your doctor. Other things that we're looking for, you want both nipples to be pointed in the same direction. We don't care which direction, but they need to be going more or less in the same direction. So if one starts going off in another direction, then we need to find out why is that happening. And then another thing I like to tell people is dimples are allowed in your cheeks, but they're not allowed on your breasts. So if you see dimples forming, you need to get that checked out by your doctor. And the last one is rashes are okay, but rashes that don't go away need to be evaluated. There is a very rare but very deadly form of breast cancer called inflammatory breast cancer. And that is the one most people come to see me because they are terrified they have it, but only 4% of all patients each year actually get it. So it is incredibly rare in the general population, but it's the one that frightens everyone the most. So if you have a red patch or a rash, or it looks like you have an infection and it's not going away and not getting better, you need to be checked by your doctor.
So how long is too long? If you have a rash, how long is too long?
Honestly, if you've tried over-the-counter treatments like steroids or antifungal creams or anything like that, or just moisturizers, if you've tried anything for 2 or 3 weeks and it hasn't gotten better, you need to see your primary care doctor and let them decide how worried they are.
Interesting. Another thing on mammograms, what is the age range? When do you reach an age where you're too old and it's like, okay, you don't have to have one again? When should you start? What are the guidelines on age with mammograms?
So there's 2 sets of guidelines, and there's the one that most people use, and then there's the one that the USPTF, the United States Preventative Task Force, has come up with. And that's the one that got a lot of press many years ago, probably about 5 to 10 years ago now. And they wanted to try and change our ages in this country to match more closely with socialized medicine ages in Europe. And so in Europe, they don't typically start mammograms until age 50, and then they do them every 2 years. And so that was what this task force ended up wanting to adopt. As far as recommendations go, it is a controversial topic. So the last 2 times that my national society has had meetings, at a conference of breast surgeons, there were people getting up there and saying breast screening mammograms don't save lives, therefore we shouldn't be doing them. Well, you're never going to meet an oncologist, a surgeon, a radiologist. You're never going to meet anyone that actually cares for breast patients that is going to wholeheartedly support that, because we want to find breast cancers at earlier stages because it saves lives. One of the many reasons why African American women pass at a higher rate than other ethnicities is because African American women tend to come in at a much later stage. They come in with a stage 3 cancer instead of a stage 1 cancer. The cancer is much larger or involving the skin before they get the medical help that they need. Why? Host of reasons. We all talk about medical disparities, social disparities, health disparities. There's a whole number of reasons. But the fact is that it happens. And if it happens, then we have to be more aggressive at educating people so that whatever little piece that we can fix, we can do.
And there's some people, naturally have lumpy breast and don't know. So if that's you, is mammogram your answer over? Or do you need to even continue to have the regular checking yourself?
Yes, you need to be familiar with your body. The way mammograms work is that they look for changes. This was not here last year, and now it is. Well, that becomes concerning. And then we do extra testing. We press it differently. We ultrasound it. We change the angle of the picture and see if that spot is real or is it just the tissue piled up on itself. And so that is why the mammograms work, is because they're looking for change. Well, the same thing is true about feeling your body and just washing yourself with your hands from time to time. Let's say you get a growth on your leg. Lots of people have these tumors called lipomas. They do not hurt you. They can be unsightly. Occasionally they can be painful, and sometimes they just get big. But if you don't know it's there and you suddenly find it, you're going to think it popped up overnight. But if you've never washed your body and you don't notice it until you hit your leg on something and you feel your leg for the first time, you're going to think it just popped up overnight when it was slowly growing for many years. So that's why it's important, whether you have lumpy breasts, whether you have soft breasts, whether you have skinny breasts, big breasts, whatever kind of breast you have, you need to know about your own body, because you are more likely to find it than your doctor.
Last area I want to ask you about is biopsies. Mm-hmm. What are reasons explain what a biopsy is, and what are some reasons a person might have to have a biopsy after they have a mammogram?
So a biopsy is where we take a teeny tiny piece of tissue to find out what the problem is. And so back in the 70s, you would hear a lot of people going to surgery and waking up and finding out they had cancer afterwards. I even have had some horribly tragic situations where people were very young, went in for what they thought was benign and came out with a breast gone. Number one, we don't do that anymore, ever. That is unacceptable, and that does not happen, at least under my watch. I can promise you that. But I can't tell you that I know anybody in the last 15 years, 16 years of my career that has done that. So with that being said, a biopsy is taking a tiny piece so that when we do need to go to surgery, if we need to go to surgery, we are doing the right operation the first time. So I many times have people come in and say, well, I can feel this. Can't you just take it out? I don't want it there. And then I have to explain to them, if it's a benign tumor and you just don't want it there, sure, no problem. I love operating. That's why I got into this business. But to get breast cancer at it can definitely change how I do your operation if it is a cancerous tumor. I have to do a completely different operation. I have to worry about things that I don't have to worry about if it's a benign tumor. And sometimes we go and do an operation for something that we think is benign, and we find out that hidden amongst it or around it or under it was a cancer. So we always want to try and go into that operating room with the most knowledge possible so that we're not having to go back again. I don't want to put you through 2 operations if I just would do it right the first time.
Awesome. And that does make a lot of sense. Once you get cancer, you can't get it again. And we know that's not true, but talk about what makes it come back?
So there's a number of different things that can make cancers come back. First and foremost, I like to explain to people that cancer that is invasive, meaning that it is broken through its original structure where it started and has invaded and grown into the stuff around it. An invasive cancer has the potential to spread to your lymph nodes. It has the potential to spread inside of the body. And with that being said, it's like those dandelions that you blow and all of the seeds go everywhere. And you don't know where those seeds are going to go. You don't know if those seeds are going to go. There's lots of dandelions that sit there and just, shrivel up and die without being spread. So you don't know if seedlings have traveled. So when we do surgery, we're getting the main culprit out. But everything that we do after surgery is trying to treat the rest of the body and trying to keep anything that's hiding from us from developing into anything. So sometimes women need chemotherapy. And when you take chemotherapy, it goes through your veins, through your bloodstream, and it goes every place, any corner of your body that it can go. And that goal is to try to treat the what ifs. I don't know that I have cancer in my lungs or in my liver, but what if those dandelion cancer seeds went there and are just sitting there trying to make a home? We can't detect things when they are that tiny. And even with some of the things that we're talking about research now called liquid biopsies, where we just see, are there cancer cells floating in your bloodstream? Well, that's fine and dandy, but if they're floating in your bloodstream and they don't know where they are, how are we going to solve the problem? So that technology is interesting and exciting, but it's got a long way to go until we can actually figure out how to use it effectively. So when we treat with chemo, we're treating with the whole body. Most breast cancers, about 70% or more breast cancers, are going to be fed by estrogen, the female hormone. And so there are pills that we can take that will starve or block the potential cancer cells from growing and developing into anything. And so that's a medication you typically take for 5 to 10 years to decrease your chances of the cancer coming back anywhere in your body. Some women will require radiation. If you save the breast, you don't want the cancer to come back in the same spot. So I tell everybody that when I was growing up, if there was a green spot on the cheese, my mom would take the wrapper, throw it away, cut off the green spot, eat your cheese, but don't put it back in that dirty wrapper. You have to put it in a fresh wrapper. And so that's what breast radiation is. It's cleaning up whatever might be left there so that the problem doesn't come back in the same exact place.
Awesome. We are out. I have more questions, but we're out of time. And I can truly tell that you're passionate about your field. And thank you so much for sharing, because the more we know, I do believe knowledge is power.
Absolutely.
The more we know, we can help ourselves or our loved ones. So thank you so much for sharing. We have other questions about food, like seafood, but we're over time. So for those of you who are watching, I always like to end with a call to action. And my call to action points this week are: know your breast health. If you're a male and you have any female in your life, your mother, sister, aunt, wife, girlfriend, neighbor, coworker, encourage them as well to be breast healthy conscious. Get that mammogram. If you're uninsured, there's still ways to get a mammogram. Is a mammogram the only answer? No, but it is an answer. It is one thing, as the doctor has shared, in your arsenal. So remain breast aware. Number 2 this week is just remain health aware. As we talked about breast cancer, so many things in how physical health and mental health are intertwined. Get out there, move, be active. It helps every area of your life. And I always like to say, be politically aware. And how does that even fit with any topic? Well, laws are passed that can impact even your health, breast health, or any kind of health. So be politically aware. For those in Texas, did you know that there is an election coming up November 5th with 8 propositions on it? We're going to talk about that next week. Be aware what's going on. And last but not least, mask up, because masking is caring. Be aware of your health safety. So once again, Dr. Dempsey, thank you for joining us tonight. Do you have, even though we're over time, do you have one final comment you'd like to make?
If you're having problems with your breast, talk to other people. Let other women know. We need to straighten each other's crowns. We need to lift each other up, and we need to be there for each other. And so I cannot tell you how many people come to me and said, I got this mammogram because my coworker got cancer and she told us about it, and I wanted to do something for myself and my health. So share your stories, share. Do you know how many women I see every single week with breast pain? And breast pain is totally normal, but we don't talk to each other about these things. And if we all talk to each other, we would understand, hey, we're all going through this.
Thank you. Share. So important. Well, once again, thank you. And thank you to all the viewers. See you next week and have a wonderful, wonderful week.